All right, we are now going to perform traction and our mobilizations for the talocrural joint. So this would be indicated if the patient was experiencing pain that we found in our exam to be related to limitation in motion. Specifically, we'd probably start with our traction and then we'd move more specific into our anterior posterior glide depending on the patient's limitation. A progression for this treatment would include us doing calf raises. So we could do calf raises and work on the patient getting full range of motion with a pause at the top in plantar flexion and a pause at the bottom in dorsiflexion. However, we are going to treat this today for Chase's right ankle. So for traction, I'm going to go ahead and have the pads of my thumbs on the patient's pads of the feet. I'm going to go ahead and clasp my hands until I can grab the neck of the talus. I'm going to go ahead and tuck my elbows in, have Chase in 10 degrees of dorsiflexion at neutral, and I'm just going to go ahead and lean my body back, keep my elbows in close, and provide a traction at Chase's foot. So that would be to perform our traction for the talocrural joint. The next thing we're going to do is go ahead and provide a mobilization for dorsiflexion. So for this, I have Chase's ankles supported off of the table. I'm going to go ahead and stabilize his distal tib fib. We are gliding for the dorsiflexion. We roll anteriorly, slide posteriorly. So we're going to be providing a posterior glide of the talus on the tibia for this. So I'm going to again grab the neck of the talus, provide stabilization at the tib fib. And I'm going to go ahead and have Chase in neutral and perform my joint mobilization. So we're making sure that the patient is in a neutral position of the foot, supporting, stabilizing the distal tib fib, and providing that mobilization on the talus. And we are addressing limitations here in the talocrural joint again. So for plantar flexion, we're going to go ahead and have Chase bend his leg. And what we're going to do here is provide now a posterior mobilization of the distal tib fib on the talus. So here I'm going to go ahead and stabilize the talus. I'm going to provide a posterior inferior force on the distal tib fib. And this can be a mobilization to address a limitation in plantar flexion.